the choice of the words that they used in the title. They talk about clinical excellence and business efficiency. And the thing that struck me is the difference in the definitions that the words excellence, as you can see put up here, and what efficiency is defined as. There is a component of both science and art when it comes to medicine, because there are always doctors and then there are doctors. And any medical doctor would attest to the fact that you don't look at the same case the same way, or you don't look at different cases the same way. Either way, there is an artistic component to medicine. And I really like the fact that they used excellence for the clinical aspect and then efficiency for the business aspect. It's a very simplified and a very direct definition of both the words that I took. And what I wanted to look at is when you look at where clinical excellence matters and how you can actually enhance clinical excellence, these are some of the areas, and not necessarily, this is not a finite list that we can come up with, but the areas that I could list were the ones that would impact both the medical doctors, ancillary staff, and also anyone that has a direct component with patient care. And if you look at any of these areas and how technology in general has helped all these people in enhancing the experience that the patient has in terms of what they've been brought in for treatment, we can readily see that it's not just IT per se, but clinical excellence in general, as far as all the tools that are available, how quickly a lab result is provided, how accurate is the result, and how appropriate is the test and the result in terms of treat patient. And there are infinite number of examples that you can come up with that all contribute to clinical excellence. Now, why is it that we consider clinical excellence important? Is it enough if we just treat a patient and send him or her home? Or is it important that we actually contribute beyond just treating them for what they came in for and actually providing them with something that would give them a better quality of life? Maybe something that would be preventative in future because they have a better understanding of what it is that they came in for and how they can avoid future episodes of a similar or other ailments. So excellence does enhance the overall patient experience when you have somebody that comes into the hospital for treatment. So it does become important for a hospital to provide that excellence. And it is not, again, this area that I'm talking about is clinical excellence in general terms, which includes the quality of the staff that you have and also other diagnostic tools that are at your disposal in your hospital. If you take efficiencies in terms of business, hospitals and healthcare have become a business. And if you refuse to look at it that way, or if you fail to look at it that way, it is hard for you to survive, or hard for you to do anything meaningful or significant in terms of what you can give your community. When I say it is a business, I'm not saying you have to operate it as purely for profit or in any sort of a greedy fashion. Business does not necessarily mean you have to gouge the patient or you have to make a lot of money. Business means that you have to earn more than what you spend so you can survive, so you can grow and actually improve the quality of care that you provide to the community that you exist in. So when I say business, business with corporate and social responsibility. So if you look at the indicators that you're looking at, the last one that I've included is clinical efficiencies. So again, to have a hospital or a healthcare provider give something that is beyond just treating a patient for what they came in for, you need excellence, you need a greater efficiency in what you're trying to do. And these things have absolutely become important because it is expected by the public. People that walk into your hospital expect to be treated, and not just for what they came in for, but beyond that. Looking at, for instance, if you have a patient with diabetes that came in with an episode of a high sugar episode, you also automatically, the patient expects that the family members or the immediate caregivers are given education about what all precautions have to be taught about so that the patient doesn't have a similar episode again, or enhances their quality of life in future, that they don't have to go through this again or manage the disease better. So that expectation is already present in the patient's mind. So whoever the immediate caregiver is also expected to be included in the treatment protocol. So these kinds of things, when you include the clinical efficiency in this respect, and again, I don't claim to be a medical doctor. I'm not a medical doctor. I don't claim to have much experience or knowledge in these areas. I'm just imparting what little experience and little knowledge that I've gained in these areas over time. So you'll have to pardon me if I make any mistakes, or if I sound like I'm talking about everything. I'm not. I wanted to look at, I mentioned that I wanted to give a historical perspective on this, and I found it very, very interesting that if you look at how early on the very concept of anatomy, which is taking a human body part and studying the musculostructural, skeletal structure, the internal organ structure. This happened in the 14th century, the 16th century. Today, the expectation that any doctor would know exactly how a human body is constructed is a given. And I'm trying to make a point here. I want you to understand why I'm stressing this so much. We automatically expect a medical doctor to know this completely well. All the organs, the functions of the organs, what kind of musculature and what kind of skeletal system a human being has. It is an expectation that we have of every medical doctor. And everything on the list, we automatically expect our medical doctors to have a good knowledge about and know what they're supposed to be doing with it. From discoveries to actual medical devices that we see in hospitals today. We don't expect to go into a hospital and be told, well, we're not going to be able to take an x-ray, you're going to have to go here or there or something like that. We walk into any medium-sized and any decent-sized hospital, we expect to see any of these equipment, and these are all tools that hospitals use as part of the diagnosis. It has become something that every one of us expects. The reason I'm stressing this is, if you go into information technology, we are now entering an entirely different aspect of medical care. No one is going to be surprised that they would be treated with all the devices at the disposal of the hospital under the same roof. But we have not gotten to the point where they expect the hospital to use and harness information technology to the same extent. We are not there yet with all the hospitals. That is why I make a big deal about these aspects of the discoveries and the devices and coming into information technology. One thing we don't want to do is that none of us, when I say us, I mean software vendors and those of us in the software industry and the IT industry, we don't want to pretend or even imagine that we are an end in itself. We're not. We aid in providing a higher quality of healthcare experience for the patients. Again, how well are we integrating all the other advances that are happening in the medical industry? If you go back to all the devices, almost all the devices are now electronically interfaceable, which means that you don't need to get an X-ray film to walk up and